I want to introduce Nancy. She's one of our patients, and she has completed our thyroid program. So, Nancy, this is kind of your story. Just kind of talk about where you were, how you found us, and what medicines you were taking, and just your story. It's your deal. So, why don't you start from the beginning?
Okay, well, I was on thyroid medicine, and I still had all the symptoms. It didn't seem to be fixing anything, but the doctors kept telling me that my thyroid was perfect, on the medicine, that everything was fine.
So when you went in, the TSH was off, then hypothyroid, then they gave you the medicine, it brought it back down, but you still had all the symptoms.
Still had
right?
all the symptoms.
Yep.
It was like, they said everything was fine, but my body was
Right.
saying, no, it's not.
Okay.
And so I just started looking on the internet for thyroid, some kind of help with thyroid because I was still having all those symptoms. And I came across your, I guess your website and some articles you had. And so I don't do Facebook, but I had my daughter put it out on Facebook. Has anybody ever heard of Dr. Roadhouse? Does anybody know him? And 3 couples from church responded and said, oh, we love Dr. Roadhouse. He's amazing. And so I came in.
Okay. So you came in, we had you fill out a lot of paperwork, and I know it took a lot of time, but we want to make sure you're a candidate. We did all the neurological testing. We found out that you were a candidate, and then we did labs, and we got the results of the labs back, and then why don't you take it from there?
And then you put me on the program. I think I came in like twice a week in the beginning.
Right.
And
We did
you
the
gave me the
oxygen,
supplements, right, did the
yeah,
oxygen.
the neurological
and
treatments, and we specifically gave you a diet based on the tests that we did.
Right,
Okay.
right. And I had to follow the diet strictly.
Which everyone loves. But it got
wasn't
results.
easy, but worth
No,
it. It
right.
wasn't easy, but it
No.
was so worth it. Well
Mhm.
worth it. I remember before I found you, I told my girlfriend, I said, I can't explain to you how I feel other than I feel like I'm dying inside. So it was well worth it because I got to feeling so much better. I got so much energy back. All my little aches and pains, which I thought, I'm 65 years old.
Yeah.
I thought that just comes with age. You
Yeah.
just, and my aches and pains went away, and just feel so much better. Feel younger, because I feel better.
Well, I think that a lot of people have seen the difference in you too.
Yeah.
They say you're spunkier. Your eyes glisten because when you came in, they were kind of dull. Your coloring was white.
Oh, my
your
everything
hair,
was.
your hair was
yeah.
falling out.
Yeah, no,
Yeah.
a girl at church did tell me. She said, "Oh, you look healthy."
Yeah,
said,
and that's
"Thank you, I
exactly
am."
right. Yeah, and
Finally.
I know that we had several discussions too about the diet and all that stuff, and because. Before she got in the program, I told her, I go, listen, it's not going to be easy. And she goes, I just don't know if I can do that. I don't, because, when I explained everything to her, it's not easy, But there comes where you just have to weigh it out and go, well, nothing else is working. And I remember I told you, if this was easy, you're taking the pill and all your symptoms have been gone. That's the easy patient, the happy patient. This right here, it's not easy, but like you say, well worth it because nothing else was helping you.
No, right. Nothing else was helping me. Doctors didn't have any answer for me. Just, your blood work looks beautiful. Everything is beautiful.
Yeah.
Go home and, like it's all in my head or something.
And that's
But,
kind of the way you feel too, because
yeah.
they're telling you normal, but yet you're still feeling terrible. Okay, so you did the program, and the hair's doing better. You've
I
lost.
lost 30 pounds, and people were amazed at that too.
Yeah.
They were like, "Oh my gosh, you look so good. You look so healthy," and and then
The
of course I
stomach
felt good about
issues,
myself.
right? Yeah.
Yes, the stomach issues. I had at night. I had cramping every night when I would lay down and go to bed, and I would think, "Do I have?" Because it was mild, but it was constant.
Yeah.
And I would think, do I have this all day long? And I just don't notice it because I'm busy,
Yeah.
But every night I would notice it. Just
So you
just
weren't
a
sleeping
sick
real good
feeling.
either.
No,
Yeah,
I wasn't
yeah.
sleeping good at all.
And then you got
I
the
would
belly bloat,
wake up,
when
yes.
you ate and all that stuff, and
Yes,
then the cramping
the
and all that.
bloating and
yeah.
everything, and I would wake up at night and I would be awake for like an hour and a half to 2 hours for no apparent
Yeah,
reason.
and wide awake.
Just
You
yes.
just all of a sudden
Yeah.
boom up and couldn't go back to
But
sleep.
it's like
yeah.
3 o'clock in the morning,
Right,
so it's
yeah.
ridiculous to get up.
Right.
So
Yeah.
just
Good,
wake
okay.
up. And
So good. All right. So I think that pretty much, You're doing great. That's what
Um,
counts,
I
right?
feel
Yeah.
amazing.
Yeah.
I feel amazing.
Well, as you can see, Nancy said, it was difficult, but it was worth it. And, if there's anybody else, that's watching this that might have a problem, we do a consultation and the exam to see if you're a candidate. We let you know you're a candidate before we do all the labs. And the labs, none of your other doctors have done any of the labs like what we did.
No, you're extremely thorough, and
Yeah.
that's what I tell people. I go like, he's so thorough that nobody else had ever done a lot of the things that you.
And that's, if we do the same test your doctor did, we would have never been able to find anything, So that's, so if you know anybody, you can contact our office, and we'll see if you're a candidate. But hopefully, this really, the reason that I want Nancy to do this is because there could be other people out there just like you. You get on the internet, you start Googling and trying to figure things out. And when you see someone that got results like you and they have very similar results, it's like, wait a minute, maybe that, because you gave up hope. But when you came, because I remember when you came in, you're always like, I don't even know why I'm here, but I'm going to give it a try,
Yeah.
And I'm glad you did, because look it took effort. You did your work and you came in, but it changed your life, and there could be other people out there too.
I did. It
Okay.
really did
Well,
change my
thank you.
whole life.
I enjoyed taking care of you. Thank you.